Well, joining me now to discuss global mental health is Professor Vikram Patel from the London School of Hygiene and Tropical Medicine. Professor, thank you very much for joining us today.
Thank you. Thank you for inviting me.
Now, your session at the conference is called Challenges and Opportunities in a Changing World. What are some of those challenges and opportunities in global mental health today?
First of all, let's start with the honest assessment of the position of mental health in the global health agenda. Mental health remains fairly marginal in the global health discourse, and one of the greatest challenges is to actually get it more to the center ground in the global health agenda. The great challenges really are, overall, the limited resources for global health, and in the current climate with the economic recession, there seems to be even greater competition for scarce resources. So I think, to be honest, that's the challenge. It's a challenge facing all the public health fields, but more so for mental health because that field was always at the periphery. The opportunities? I think the greatest opportunity is that in the last year I have observed a number of new initiatives, many of which are backed by substantial new resources that are being committed to global mental health. Just to give you one example, recently DFID, the British government's foreign aid arm, announced a major call for applications to support new research, policy-relevant research on improving mental health care within primary care in developing countries.
Now, last year when you spoke to Global Health TV, you discussed how stigma is one of the biggest challenges. That was last year. How far have we come?
Well, I can't give you any empirical data on that. I mean, it wasn't as if I had surveys to show, document, for example, levels of stigma before that I can then compare against today. But anecdotally, from my own daily experience of working in this field, there is no doubt that people are much more willing to accept and talk about mental health as an important public health issue. For example, in ministries of health, it is not uncommon now that when you talk about mental illness, you will secure the interest of a Secretary of Health. Similarly, in agencies that have historically not really supported mental health research, people are now interested in that subject. So if that's one indicator of the greater acceptance of mental illness within important stakeholder communities, I would suggest that stigma is reducing.
Now, you are a founding member for the Movement for Global Mental Health. You had your first summit last September. What were some of the outcomes that came out of that?
Yes, we did have our first summit in Athens in September last year. First of all, it was a terrific opportunity for all of us to meet for the first time since the movement was launched, and really that was the main purpose, was actually to give a face-to-face meeting opportunity. But a lot else happened. We had some iconic figures from movements that we admire and should learn from, in particular the global HIV movement. So we had the head of the Treatment Action Campaign speaking to our members and teaching us really how to strategize the movement to make an impact at the level of global policy. We've taken a lot of lessons from that, and we are working very hard, for example, to increase the leadership role of people affected by mental disorders within the movement. To make more coherent cases on reducing the costs of mental health care. These are just some examples of what the global HIV movements have done to make their case in global policy, and we're learning from them.
Well, it's been a pleasure talking to you today, Professor Vikram Patel, and thank you very much for joining us.
Thank you.